What do you think looking forward is going to be the hardest thing for the biopharmaceutical companies to do if they want to convince MS specialists that, this chronic inflammation or PIRA, as we call it, can actually be stopped? How do clinical trials need to be designed to convince you and your colleagues?
I think we're trying to develop better markers of this chronic inflammation. And that's where you're getting like these slowly expanding lesions and PIRA. PIRA has been described for some time now, but it's really come to light, particularly in the age of broad use of highly effective therapies. It's not a common occurrence, but even patients on B-cell depleting therapies experience PIRA. So it highlights the notion that progression is present at the outset of the disease, and becomes more of an issue as people proceed with longer disease duration and older ages. PIRA is a tricky measure that is much discussed at meetings and among experts, but so far has not met regulatory approval in terms of how to negotiate that as a endpoint that would sort of meet the criteria for approval for a progressive study. PIRA has a lot of interest because it's really what we see in our practice. We see patients with relapsing MS who complain about worsening ambulation and balance and cognition, but when you do their scans, you're not really finding any new lesions. So I think it has sort of that analogy to clinical practice that is quite relevant. The issue is, how do you detect these things over time in a progressive population? We're seeing that confirmed disability worsening in the modern era in a relapsing patient is at exceedingly low rates, under 10%, sometimes as low as 5% over the course of a trial. And CDW is comprised of PIRA plus raw relapse-associated worsening. So you sort of have a small number on top of a small number. So powering this, in addition to demonstrating its veracity in regulatory perspectives, will certainly be something that we need to explore. Yeah,
a little challenging. Well, listen, doctor, thank you so much for doing the short interview with us. This has been great to hear, and will be very, very valuable to our clients. Thanks.
Thanks a lot, Blaine. Talk to you later.